Fabio. Is there? Oh, we have Joe and Angelo. Very nice to see you both on the call.
Hi guys. Sorry, we had some technical difficulties.
No, that's good. I'm glad you were both able to join. Thank you. So I need a vote on the agenda as displayed in front of you. All in favor? Is there anyone opposed? Okay, that is carried. Now, with that, we have our board elections. And what we've done here at the Health Unit, we've been able to create a work within teams to have a system that we'd be able to do the voting online and give you instantaneous results. And as such, what we're going to do for our elections, I'll kind of lay it out. We need an election for a board chair. We will need an election for a vice chair. We will need an election for a treasurer. And we will also need 2 members, 1 from the city and 1 from the county, to participate in our project governance committee. So what I will do is I will get the pieces moving forward for the chair. And what I'd ask the committee is for any nominations from a board member in terms of the position of chair. So we would be receiving any nominations for the position of chair. Joe?
Yes, I'd like to put forward and nominate Councillor Fabio Costante.
Okay.
I'll second that.
Thank you, Hilda. Fabio, do you stand for that nomination?
I do. Thanks, Dr. Ken. Thanks, Joe and Hilda, for the nomination.
Sounds good. I will then put forward, are there any other nominations for the position of chair for our board? I'm scanning the screen. I will going once, going twice. Okay, last time, are there any other nominations for the position of chair? Well, Fabio, congratulations. You are new chair. We're very happy to have you in that position. I know you will represent us very well. And I will now pass the meeting over to you. And again, our team will assist you. I know it's not your first meeting at the Health Unit, but I know your first meeting as chair. And if there's any way we can assist along the way, we'll be there for you. So over to you, sir.
Thanks, Dr. Blanchette, and I'll certainly need some assistance, I'm sure, at least in this first meeting. Hi everyone. It's certainly an honor to have been nominated and elected chair, and recognize I've got big shoes to fill, but I really look forward to working with what will be the upcoming JBEC, the board as a whole, our CEO, medical officer of health, and of course the senior management team. And so I guess we'll get started, or I guess continue with the elections. We'll have to call a nomination for vice chair at this time. Could somebody please, I see Mr. Shepley and Councillor Marignani. Councillor Shepley?
I'd like to nominate Joe Becchetti for vice chair.
Okay, Joe, Deputy Warden Becchetti nominated for vice chair. Could I get a seconder? Angelo, is Joe kicking you underneath the desk there to second that?
Yes, I will. I will second that nomination. Thank you.
Thanks, Councillor Marignani. Any other nominations for vice chair? Going once, going twice. The approval of Deputy Warden Joe Becchetti for vice chair. Joe, do you accept the position?
Yes, thank you to my nominators and supporters, and I look forward to working with the board for this next term of council. Thank you.
Congratulations, Mr. Becchetti, and now we'll call the last member of the JBEC, the treasurer of the Board of Health. And if I could ask for your indulgence, Dr. Blanchette, I'd like to nominate this individual, if that's okay. If I can ask the indulgence of the board, I'd like to nominate the warden, Hilda McDonald, if you'd graciously accept the position of treasurer.
As long as I get lots of help, because I've never been the treasurer. And when I was in grade 6, I'm sure my math teacher would not have recommended or seconded. But always willing to learn. Sure. Thank you.
Thank you, Warden. Could I get support for that nomination, please? Deputy Mayor Shepley, that's your proper title. I got to get used to everyone's proper titles too here. So I've got a seconder. Anyone else would like to make a nomination for treasurer on the board? Seeing none, congratulations, Warden McDonald, and we look forward to working together. Okay, and I think now we've got to fill in the rest of the gaps for our project governance committee. And perhaps, Dr. Blanchette, if you want to just give a very high level on what the committee is going to be working on. Now, obviously, the relocation is key, but if you want to just give a high level so folks are going into this with eyes wide open.
Absolutely. So the committee is the primary focus of it is to our current lease here at 1005. It's expiring. The building itself is not capable of housing our full complement of staff and the services. And the project governance committee was created to oversee finding a new site, the relocation piece, any capital infrastructure that's involved, and to make sure that we still met within the mandate of our budget pieces and to ensure that we were going to get into communities that were best needed for our services. Now, that committee itself, it's made up of our 2 provincial reps, Judy and Robert Maish. We also have to have 2 city and 2 council members on there. The terms of that committee themselves is the way the terms of reference are written. There are those that are in position that will last unless their position ends on the board. So right now we have Fabio and Joe and Judy and Robert Maish on there. So we have 4 out of the 6. But what we are looking for are 2 other individuals that would like to partake in this committee. We need 1 from the city and 1 from the county. And I guess the appropriate way to go would be to ask for volunteers in this position. And if more than 1 person volunteers, I think we would probably go to a vote. Again, we have it set up electronically that we can do so live. But that is the process, or that is the committee itself. I guess I'd be open to any questions. I'm sure if people want to know a little bit more before they volunteer for something, I would open up the floor through you, Mr. Chair.
Absolutely. Any questions from the board? So this is a nomination process then. Could I get any nominations for this committee?
From the county, I would nominate Rob Shepley if he's interested.
Sure, I'll stand.
You're being voluntold, Rob. Any other nominations for the county? Seeing none, congratulations, Rob. You'll be joining the project governance committee. Now on the city's end, any interest or nominations coming from the city? Don't make me out to be the bad guy. I'm gonna have to pick one of you 2. Ronaldo?
I would do it.
Okay. Ronaldo is, thank you so much for that, for being a willing participant. Any other nominations on the city's end? Okay, congratulations, Ronaldo. Looking forward to working with you on this committee as well. Okay, well, that wraps up all of our elections. Now I'd like to turn it over to Dr. Nazatari to provide some greetings and perhaps a verbal on what's happening with the Board of Health.
Thank you. Board of Health Chair, Mr. Costante, members of the Board of Health, my colleagues, professional staff. Thanks for allowing me to speak today. I'm going to be brief because I know we have lots on our agenda, but I do want to share with you that it's been a privilege to serve as the Acting Medical Officer of Health for, I think, now the past 16 months. And I want to share with you that the team at the Public Health Service, Ken Blanchette and all the leaders of the health service are committed to working with you in advancing the health of the community. I think it's an exciting time, 2023, and we have a number of important priorities to address in the public health service, and I hope that we can work together to effectuate those goals in a positive manner. So thank you for that, and my report will be more robust the next time when we have a little bit more time.
Thanks, Dr. Nazatari. And if I could just remind everyone to mute mute their screens if you're not speaking, because it's just giving us some background noise. Very much appreciated. Okay, so let's move on with the agenda. We've got the approval of the minutes of the regular board of November 10th, 2022. Any questions or comments on the minutes? Seeing none, direction, please. Judy, like to move the minutes? Moved by Judy, seconded by Rob. All in favor? Opposed? And that carries. That takes us to item 7. There's no business arising, so we go to the consent agenda, item 8. Any questions or comments on the consent agenda? And for the new board members, just so you know, we'll be eventually approving these items as a package. So if you do have any questions, ask them now. If you want to go so far as to pull an item off of the consent agenda and place it on regular business, it's your right to do so as well. But generally speaking, if it's just a question or two or a comment, now's the time to do that. So any questions or comments on the consent agenda? I see Christy Macbeth has raised her hand. Go ahead, Christy.
Hi, thank you, Mr. Chair. I just wanted to provide an update. There's an information report related to immunization and our enforcement process for the elementary school age. And in the report, the number that was provided as of January 9th was 9,069 students that were considered to be out of date. And I have a happy update from just yesterday, and our number of outstanding students is down to 6,971. So we are making immense progress. That's 2,000 students that have been removed from that list in the last 10 days, which is a tremendous effort. So very grateful for our team here at the health unit. We still have a long way to go, but certainly are making great progress very swiftly.
It's really good news, and I'm glad you've provided that update. Any questions on that from the board? Okay, seeing none. On the consent agenda as a whole, direction, please. Moved by Warden McDonald, seconded by Councillor Marignani. All in favor, opposed, and that carries. It now takes us to new business, and I'll turn it over to Dr. Blanchette to give the CEO quarterly report. Off to you.
Did we miss
I'm
number
on
9?
mute. So sorry. Hey, everybody has to do it in the meeting. I'm glad it was me instead of any one of you, right? So the quarterly report is it was in your package, and just to kind of highlight pieces, this report. Yes, Judy, you had a question?
Sorry, did we skip 9.0?
The CEO report.
The budget?
Oh, Judy, you know what? I think I know what's going on. We had updated the agenda this morning, and what we had done is the vote for the budget was moved after for sequencing purposes, so we could do the presentation. So my apologies.
Sorry, just checking.
No, I'm glad you asked the question. So the quarterly report before you, this is to ensure that the health unit is operating within its mandates, that we are meeting all of our payroll. There's no unexpected lawsuits or unexpected dismissals from the corporation. So all of the items we have been verified. This has been signed off. So for you as a board, that the full operations of the WECHU are falling within all the parameters that are set forth by the ministry and by the board. So I would be happy to open up any questions you might have regarding the report.
Any questions on 9.1? Seeing none, so we can, and thanks for that, Dr. Blanchette. We'll go to the Board of Health Assessment Survey, 9.2.
All right, thank you, Mr. Chair. As part of our mandate as well in our board, the Ontario Public Health Standards and the good governance is that we have to do a self-assessment process of our board. I believe it's every couple of years. And in order to meet this requirement, we've developed a competency-based self-evaluation. And what better time to do it than right now with the brand new board, so that we could really look at the skill sets that are involved, your knowledge as well. And it will also help guide us in terms of developing our board education that we do on every meeting, so that we can get you all up to speed as quickly as possible and give you all the right information you need for all the major decisions you will be making over your term here on the health unit. This will be sent out electronically to everyone. Christy, can you, what was the date again? Is it a couple weeks, I think? Or?
Yeah, it'll be within the next week or two.
Yeah. So it'll be sent to all of you electronically to be able to complete. And I can't remember the deadline that we had on that as well either. I think it was within
We certainly like as much completion rate, 100% is the target. So hopefully within a couple of weeks, but certainly we'll work with everyone to make sure that everyone can complete it.
Yeah. If there are any questions or concerns as you go through the survey, please reach out to us. We'd be more than happy to help guide you through any login issues or questions about the survey itself. But we do really encourage everyone on our board to participate in it. It is what makes us better as a team. It will help us meet our mandate as well. And again, it will allow us to help tailor our education and our presentations to the board so that you can make the best decision with the best knowledge. So over to you, Mr. Chair, and open for any questions.
Thank you, Ken. Any questions? Okay, well, we look forward to receiving that information in the near future. Item 9.3 is the Association of Local Public Health Agencies, ALPHA Winter Virtual Symposium. Again, I'll turn it over to you, Ken.
Thank you very much, Mr. Chair. This is our provincial advocacy body, and I would highly encourage our board members, existing and new board members and existing board members, to attend the ALPHA conference. It is virtual this year. It is something that we feel that would create a higher level of education. Not only, I'll back up a second. Public health has got its provincial mandates, and there's that framework that you all received in your package about how we are supposed to operate. But one of the most important pieces of public health is how we implement our programs to suit our community needs. Being a part of ALPHA, you'll be able to see provincial pieces. You'll be able to see a lot more education as to what other communities are doing, where we might be able to learn from them. We might be able to share our knowledge with those other folks, but it's a great educational tool. I will be attending. Some of our staff will be attending as well. And we highly encourage all of you to be able to attend. So please, if you would like to, let us know. Reach out to Leanne. We can help with the registration process. And again, I'll be open for any questions on that piece. And is there anything that the team would like to add on that part? Oh, okay.
Any questions on that symposium? Okay, so if there's any interest, of course, message Dr. Blanchette or
Leanne,
the team, or Leanne to get logged in and to participate. And so that takes us to 9.4, and this is the February 16, 2023 Board of Health meeting time. I think it's just for approval and consensus that that's a good time. Is that correct?
Yes, and there's a little bit more to that as well, Mr. Chair. As with today, there was another meeting that occurs, the IRCA that was having their annual general meeting, and we are having the same situation on February the 16th. Our goal is we would like to be able to get our board meetings face to face, but IRCA is also having another meeting that same day on the 16th that starts at 6 o'clock, and we have two of our board members that have a responsibility to that organization as well. So we would like to poll our board to see if we could perhaps start a little bit earlier that day to ensure that our members that are on both of those boards have the time, if need for travel and or even for virtual, can attend both meetings without delay. So we would like to pose that question, and I believe Leanne was with the suggested time 3 or 3:30. I think it was 3:30.
It was 3:30, yes.
Yeah.
Okay, so perhaps what we can do is, does anyone have any objection to a 3:30 start?
And it's just for the 16th.
Just for the 16th, okay. So I'm not, and do we know moving forward that there's not going to be overlap with IRCA throughout the remainder of the year?
That is correct.
No, there isn't any, no.
Okay.
Yep, we verified that as we discussed, it was just these first two meetings, Mr. Chair.
Okay, so seeing no objections, I think we could all agree then that 3:30 would be the start time of the February 16th meeting. And that takes us to 9.5, which is a 2023 annual service plan presentation, program and community needs overview. And I'll turn it over to Christy and Eric to provide that presentation.
Thank you, Mr. Chair. I'm just going to try
Christy,
and share.
Christy, if I could, sorry, could you just up your volume a bit?
Oh, sure.
Sorry.
But I know how to do that. Is that better?
Is it just me, guys, or are you? Okay.
It might be your mic, Christy.
Sorry about that. Any better?
A bit, yeah.
Okay. I'll do my best to speak loudly, which is generally not a problem if you ask any of my colleagues. So I'm just going to share my screen. So thank you. My colleague, Eric Nadelin, and I are both program directors here at the Health Unit. We're going to give you a high-level summary of our organization's annual service plan for 2023. So I'll just do a check. Dr. Blanchette, you're the only person I can see on my tiny box in the corner. So can you see the slides? Perfect. And please stop me if anyone has a question or raises their hand, because I can't see anybody else right now. So we're going to provide you with a high-level summary of really all of the plans that our teams have developed here at the Health Unit for the Ministry of Health. So creating an annual service plan is a requirement from our Ministry of Health. That's one of our primary funders. And what we've tried to do on these slides is give you all a bit of an overview of the program. Certainly, to be candid, this is not a complete representation of everything we do here at the Health Unit, but it does give you a good sense of not only what's required from us from a delivery perspective provincially through the Ontario Public Health Standards, but it'll give you a sense of locally how we have then taken those standards and really tried to customize our programs and services here to really meet the needs of Windsor-Essex County residents. So the development of an annual service plan certainly starts, and Dr. Blanchette mentioned this in item 9.3, is really rooted in the Ontario Public Health Standards. So these are provincial standards that are provided to all 34 public health units. It is then our job to develop programs that are based on the needs of our local priority populations as well as our at-risk populations in Windsor-Essex. These programs and services, and certainly our human resources, are then tied to budgetary plans, which my colleague Lori Gregg will talk about a little bit later in the presentations here. So our approach to this is it's a comprehensive one. Not only are we looking at the provincial requirements, but we're also looking at our organization's strategic plan and how everything that we do here is linked to that plan. We also look at items like evaluation and course quality improvement, which are inherently tied so that we can make sure that every rendition, that every activity and every opportunity that we have to improve the health of Windsor and Essex County, that we take that and we embed that year to year to make improvements. What isn't also noted here are corporate plans. So certainly there's lots of other departments here that not necessarily service the public directly from a client perspective, but are really supporting some of what are included in the standards as foundational standards. And these include items like our risk registry, our continuous quality improvement plans, our human resources strategy, our IT management strategy. So those are all things that do happen, but aren't necessarily a part of this presentation. And certainly my colleagues and I around the table would be happy to provide information about that at another time, but certainly trying to make the most of giving you a snapshot of what we do here in preparation of this plan and budget. So as I mentioned previously, one of the overriding focuses for our annual service plan are certainly our community needs and our priority populations. Our approach is an evidence-based approach. We look at what does the evidence tell us? What are some of the approaches taken in other jurisdictions that have worked? What can we apply here locally? We also consider our local data. Certainly access to local data continues to be a challenge across the board, but every chance that we get, we're looking at what our local data is, what is our provincial data, what is national data in some cases tell us to help us better plan for really an integrated approach to public health. Our local priority populations certainly are really the foundation of what you're going to hear here today from our team's perspective. We've also, in the last few years, certainly that really emerged during the pandemic was really an integration of focus on high-risk postal codes. We have many here in Windsor and Essex County. Over half of our population lives in a high-risk postal code. And it's also integrating with other community initiatives such as the High Priority Communities Fund and integrating our work into the work that's going on at the larger level level, certainly in partnership with the Ontario Health Team, with our local hospitals, with our other sort of healthcare providers here on the ground. And really what you're going to see is these plans are a balance of not only meeting our provincial requirements for programming, but making sure that we remain flexible and that we can be locally responsive to make sure that we're covering, not only what we have to do from a public health mandate perspective, but also what our residents and our community need us to do in service of really issues that are near and dear to them. I'll turn it over to my colleague, Eric.
All right, thank you, Christy. So digging back into the standards, they represent our organizational mandates, and while they're the same across all health units in the province, they do, as Christy mentioned, provide discretion at the local level based on the unique needs of regions and communities. So within the Ontario Public Health Standards are the 4 foundational standards of health equity, evidence-based public health practice, population health assessment, and emergency management. And these provide the pillars for effective public health programs and services across all program standards. They also serve as a lens through which all programs are planned and a benchmark by which they're evaluated. The program standards themselves will be provided in the next slide, but within the standards come a number of different supplementary documents to further define the mandate. There's protocols which provide direction on how boards of health operationalize specific requirements, and they aim to have consistent implementation across all 34 boards of health. There's guidelines which provide direction on how boards of health approach specific requirements, but also aim, again, to provide the discretion to public health units so that they can operationalize them based on unique local needs. And then there's reference documents, which are topic-specific documents that provide information and best practices related to implementing the standards, protocols, and guidelines. And again, looking at effective public health practice and evidence-based public health programs. The next slide, Christy. So the remainder of our presentation will be digging a little deeper into the 9 program standards, and these are grouped thematically to address chronic disease prevention and well-being, food safety, healthy environments, healthy growth and development, immunization, infectious and communicable disease prevention and control, safe water, school health, and substance use and injury prevention. Boards of health take these standards, assess, plan, deliver, manage, and evaluate programs and services cohesively across these areas, and they impact multiple settings and to meet needs across the lifespan. An important thing to remember is while these standards are provided in these broad 9 categories within the Ontario Public Health Standards, they're operationalized across numerous departments at the WECHU. So we'll describe this a little bit further in subsequent slides, but just to acknowledge that we don't have 9 departments here at the WECHU. These standards are operationalized across, one standard may be operationalized across numerous departments. If you could switch, Christy. The first standard I'm going to get into is the chronic disease prevention well-being standard. Chronic diseases of public health importance include, but are not limited to, obesity, cardiovascular disease, respiratory disease, hypertension, and mental illness, which are all a large burden on the local health system. Chronic illness differs from acute illness in that it lasts for months. And can frequently be prevented as well as improved or eliminated through changes in a person's lifestyle. Whereas acute illnesses represent the sudden onset of a disease that lasts for a short duration. Here, the standards require us to develop strategies that lead to the adoption of healthy lifestyle behaviors at a population level, which prevent or reduce risk. Many of the activities tied to this work involve serving as a community hub, developing programs, maintaining networks or working groups, and serving as a resource to community partners related to different risk factors. Some examples of the work being done under this standard include a relatively new body of work tied to promoting positive mental health in our community. Our role within the broader mental health system is to promote to the public the concept of positive mental health, prevention of mental illness, and address stigma related to mental health issues so that members of our community feel comfortable seeking treatment. We also act as a resource within our community to our partners by sharing data, expertise, and resources to help clients, patients, and the general public navigate the complex mental health system locally. A separate body of work supported by our nutrition staff takes a systems level and direct client service approach to addressing healthy eating behaviors for the prevention of chronic diseases. This involves leadership of large community collaboratives like the Windsor-Essex Food Policy Council, which involves farmers, elected officials, municipal administrators, grocery stores, and restaurants to collect data and advocate for policy change related to the local food system and ultimately encourage healthy behaviors. Direct client services are also offered through this team, who facilitate a network of community registered dietitians and draft curriculum for them to teach their clients through online and in-person training sessions for higher risk community members. You can flip it, Christy. Other examples of activities under this standard relate to promoting physical activity to higher risk populations like low-income children and seniors. We show leadership in groups like the Windsor-Essex Communities in Motion, which coordinates municipal recreation staff to increase access to recreation programs, and provide education sessions to community groups like Life After 50 on safe physical activity, and working with our municipalities, as well as working with our municipalities on programs that you might be familiar with, like the countywide active transportation system. And you can flip it again. The second standard that we're going to get into is the Healthy Growth and Development Standard. So the WECHU operationalizes this standard through the work of our expert staff in the Healthy Families Department, which offers a number of programs and services to new families from preconception to the transition to school year. It's worth noting that the work under the 100% funded Healthy Babies and Healthy Children home visiting program that represents one of the protocols that I mentioned earlier is a major output of this department. In addition to that, the program deploys nurses, social workers, and family home visitors to assess, educate, and refer to services once families leave the hospital. Within this standard is also our breastfeeding services, which provide customized breastfeeding support over the phone via the Healthy Families Hotline, as well as a 48-hour postpartum feeding assessment for all new parents in order to provide guidance for those who are experiencing challenges feeding their new babies, and lactation consultations with certified expert nurses within the department in the form of in-person or virtual appointments. We also house a nurse practitioner clinic on site, which provides primary care and mental health supports to new moms and infants from birth to age 6. In order to provide a broad range of support to both parents and children from preconception to school age, the work under this standard also involves consultation and coordination with the health, education, municipal, social service, and other sectors to position health unit staff to provide unique and complementary programming, which positions children to succeed when they enter the classroom and beyond. Some of the programs offered at the health unit include parenting support programs taught by our public health nurses, social workers, and health promoters. These programs prioritize higher risk groups, take into account the unique challenges faced by these groups, and develop or modify curriculum to best meet their needs. These programs are numerous and are best described in the ASP summary that's part of your board package as well. Back to you, Chris.
The next three standards that I'm going to talk about are really primarily rooted in our environmental health department. So food safety, one of the really, I would say, the backbones of public health, certainly around some of the things that probably many of you are familiar with. So certainly we have a team of very qualified and certified public health inspectors who are responsible for routine inspections of all food premises in our community. So we have our risk assessment procedure creates really groupings of facilities based on the types of food and how food is prepared. So all of our food premises are divided between high, medium, and low risk, and that would determine their frequency of inspection. So all of our high-risk premises are inspected 3 times a year, our mediums are inspected twice, and our low-risk facilities are at least inspected once. So that's a huge burden of work in that environmental health team, and certainly an important one. We also, as a part of the standards, are required to have a 24/7 on-call response, and certainly that's not just limited to food safety, but it is a response mechanism that we use here to support any after hours and weekends, really reports of foodborne illness, outbreaks, and emergencies in our community. That would include things, as an example, like a restaurant fire on the weekend, and we would then have a system to deploy our public health inspectors out to support a facility that was experiencing an issue prior to reopening to the public. We also get a number of complaints that come in on an annual basis, and our protocols are to respond to all complaints that we do receive. We do also take anonymous complaints as well as named, and those are followed up in particular in our food premises. In addition, all of our inspections, including complaints, are a part of our public disclosure system. On the WECHU website, you have access to all inspection and reports within really a few business days once the public health inspectors have completed those. And that's really information for the public that are looking for information about a certain type of food premises and their compliance with the food safety regulations. We also provide food handler training, which again is part of a requirement for all food premises in Windsor and Essex County and certainly in the province. We provide this training online, not only to the general public as well as those working in food premise facilities, but also we target priority groups or different types of facilities. As an example, churches or camps that are providing food and providing service of food to any priority groups as well. One of our sort of founding principles, certainly in public health, is public awareness. You'll see that rooted through almost all of the activities that we do here. So not only does the food safety standard require us to do inspections and ensure compliance, but a part of that is also educating our public about foodborne illness and safe food handling practices, not only in premises, but also within the home. The next standard is safe water, and that safe water standard is really broken into two areas. One is recreational water, as well. The second one would be drinking water. So our recreational water is really around inspections related to public pools, spas, splash pad, water slides, and wading pools. We also support a beach water quality testing, which I'm sure many of you, in particular our municipal councillors, are aware of. Year to year in each municipality, our health unit has students that come in, and we support all of the testing on a weekly basis and post those really so that the public is aware of any water quality issues before attending one of our beaches. We also work with the municipalities really around an education component there as well to make sure that the public is educated about what those water quality indicators mean. Drinking water and monitoring and surveillance is another huge component here for the environmental health team. We support small drinking water system inspections and operator training. We do have quite a few here in Windsor and Essex County of small drinking water systems, which primarily are located currently on Peely Island. And so we do have a program where our inspectors actually attend and make sure that all of those are inspected on a routine basis, as well as any new operator training that's provided. Again, as noted, our on-call response, our 24/7 that is required, is also certainly to respond to waterborne illness reporting. Those come in primarily from our municipalities or our utilities, as an example, if there's some kind of an issue that comes up, a broken water line, where a boil water advisory, as an example, may have to be issued. Again, our public disclosure system is also rooted here for our safe water. All inspections are posted online, and we do provide education around water safety attached to that. And certainly, again, education to our community about not only drinking water, but the use of recreational water systems is another priority for that department. And healthy environments. This is really I would say, a very broad ranging standard. This gets into quite a few areas, in particular related to policy development. So certainly the team's role in this is around planning and response to environmental hazards and exposures. And the range of that can be quite broad. Those can be naturally occurring. They could be, as an example, fires and floods, things like that. We also consult with our municipalities on climate change and extreme weather strategies. So as you know, during the cold weather, the health unit does send out cold weather alerts and provides information online related to that, as well as certainly in our summer months around heat warnings. And we also work with our municipalities to provide information to the public around where folks can access services in particular during those times of emergency. We also are collaborating with many of our municipalities and our regional partners around a climate change strategy, and certainly very committed to working with our municipalities to embed policies and different types of strategies that really promote climate change initiatives. We also inspect all public spaces related to healthy environments that are tied to things like seasonal housing. So certainly our county partners are probably very well aware of all of the seasonal housing accommodations. We have one of the highest in the province in terms of the numbers. So our inspectors do inspect all new seasonal housing facilities when they open. We certainly are working with our operators on an ongoing basis. We also inspect recreational camps, ice rinks, and arenas. And certainly our 24/7 response requirement does tie certainly to health hazards, many of which are unpredictable. And certainly that is a part of the response from a health hazard perspective could actually touch on many of the other standards that we've already spoken about, really dependent on the type of emergency that's presented. Back to you, Eric.
All right, thank you. So under the substance use and injury prevention standard, some of the work that you've seen in the community around the Windsor-Essex community opioid and substance strategy would fall within this. This is a strategy that was the health unit is is the founding member and continues to be the backbone organization to maintain progress on that strategy. Since it was developed in 2017. We also serve as the community hub for the distribution of naloxone to partner agencies. So any agency within the community which distributes naloxone outside of those distributed in pharmacies obtains their naloxone from us. Part of our mandate is to increase public awareness of overdose prevention and the benefits of a harm reduction approach, which leads us into being the lead agency for the establishment of the local consumption and treatment services site, including the extensive community consultations, the leasing of the space, the retrofit, applications to the ministry, and maintaining that liaison role between the community, the appropriate ministries, and the health unit. Development and distribution of resources related to a very complex referral system and system navigation resources as well for the community, and then ongoing surveillance of overdoses, and we maintain the community's overdose response system. Under tobacco and vaping, our mandate is to reduce youth access to tobacco and vaping products. We are actively involved in the development of municipal policy and have been for several years, as well as the enforcement of Smoke-Free Ontario Act 2017. We offer one-on-one cessation services and through a counseling program, as well as a nicotine replacement therapy distribution program. And we work with local partners regarding substance treatment, including, as I mentioned, referral pathways. Under alcohol and cannabis, our goal is to increase the use of screening tools and referrals amongst community agencies. They're a big part of our annual service plan for 2023. And then to continue supporting municipalities with assessments of new cannabis retail operations prior to these retail outlets opening in their jurisdiction.
The next standard is immunization, and certainly we've seen a distinct change in the amount of work related in particular to immunization. So at the heart of this is really, as many of you are probably familiar with over the years, the health unit provides school-based immunization clinics to our eligible grade 7 students. Those are basically 2 rounds each year where our teams go into all of the schools and provide access to vaccines to that grade 7 cohort. So that's something that we've done traditionally, and that continues on even to this day. During the pandemic, we reduced a little bit of that to just our high-risk schools, but that is a fundamental of what the immunization standard from an ongoing perspective we've always maintained. Our responsibility under this as well is to assess and enforce the requirements of ISPA in schools, so both elementary and secondary, as well as our licensed childcare centers. I did speak about this a little bit related to the report on the consent agenda and our progress with the elementary schools. And as many of you are aware, we did partake in a catch-up process for our secondary schools back in September. In addition, certainly COVID-19 vaccination continues to be a big part of what we do here from an immunization perspective. Not only are we providing on-site clinics, we also still provide mobile clinics with a real focus on priority and under-immunized groups. Currently, from a COVID-19 perspective, that would include the pediatric group, our immunocompromised, and then individuals in high-priority postal codes continue to be a focus, in particular for those mobile access sites. We also are heavily involved in emergency response vaccination support. So certainly for outbreaks and emerging infectious diseases, a couple of examples of those would certainly have been monkeypox. In 2022, our health unit did provide a number of sort of mobile strategies that targeted our high-risk groups. Certainly chickenpox, we do see outbreaks of chickenpox, not always only something we talk about all the time, and certainly as we think about in the future, hopefully not, but things like polio as an example as well would be something where there potentially is an immunization response required, and public health would be a part of that. And again, just noting, a big part of the role here as well as planning for emerging infectious diseases. So it's important to take a lot of the emergency plans that we've really been able to, not so happily, but definitely implement during the pandemic. It has given us a chance to really hone in on what would be required from an emergency response perspective, which really increases the readiness of the health unit to be able to respond for any new items that are coming our way. We also support the ISPA exemption process. And so recognizing that there are some individuals that potentially are either unable to be immunized for some of those required vaccines, there is an exemption process that does have an education component required. So our health unit operates that on an annual basis or as needed. We also every year, we support our respiratory illness and seasonal influenza campaign. Flu vaccine and the distribution of that is a large amount of work here. We distribute all flu vaccine to Windsor and Essex County providers year to year. So certainly that's thousands and thousands of doses that come into the health unit that we distribute to our healthcare providers to provide to their clients. We certainly work with our healthcare providers around engagement to not only support immunization on those high priority groups, but also really to just focus on increasing uptake around immunization and making sure that people are getting the immunizations that they need in the time frame that they need. We also heavily support supply, distribution, and cold chain inspections for publicly funded vaccines. So as an example, all pharmacies that receive flu vaccine on an annual basis do receive a cold chain inspection to ensure that they're meeting all of the requirements in order to safely house and distribute vaccine. We also monitor and investigate all locals' adverse effect reports that come in. Those come in from our healthcare providers, really for folks who have reactions after a vaccination, and those are all a part of a provincial monitoring system that really help bring forward and flag any sort of systemic issues related to effects after vaccination. The next standards are infectious and communicable disease prevention and control. Certainly, this has also been something that many of you are familiar with over the last 2 years related to COVID response and our case and contact management. It has been something that our health unit and all 34 public health units in the province have done really for all diseases of public health significance over time. We're responsible for tracking and supporting the management of outbreaks. Certainly, the predominant outbreak at this time are COVID-19. Certainly, we're seeing those in our long-term care homes and our retirement homes. And our health unit, our role is to not only monitor and support, but also to help really with outbreak management strategies in those facilities. Also, our vector-borne and disease transmission and monitoring system happens year to year. That's our environmental health team. We have our mosquito surveillance program and certainly our larviciding program, with many of our municipalities are very familiar with. And again, really the significant amount of work under this standard is really around case and contact management, which varies based on the disease of public health significance. So as an example, there's a COVID-19 response plan. There's also a monkeypox. There's also a chickenpox as an example. So this team is really rooted in all case and contact management strategies for all of the diseases of public health significance, which are required to be reported to us here in public health. We also support through our environmental health team, animal bite investigations, and certainly our rabies prevention program. We investigate all reports of animal bites. Those come in not only from members of the public, but certainly from our healthcare providers as well as veterinarians. We have a tuberculosis testing, tracking, and case management system, which includes the management of latent TB infections as well as medical surveillance. Certainly, collaboration with our local healthcare providers in this area is incredibly important, making sure that healthcare providers are aware of what needs to be reported to us, and as well as supporting not only preventative immunizations, as well as supporting any high-risk client outreaches related specifically to one of those diseases. Our health unit is also the regional infection prevention and control hub program. The purpose of this program is really to support all high-risk facilities to support the fundamentals of IPAC. We also host a local IPAC community of practice for our providers and our hospital, and certainly it's a matter of working together and ensuring that there's knowledge and awareness of best practices for all of our high-risk facilities here in Windsor-Essex to keep everyone safe. School health is the next standard here. It's broken down into a couple of areas, and I'll turn it over to my colleague Eric in just a minute to sort of talk about the one half. But this half will really focus on, it's really our health promotion supports that we provide. We use a prioritized planning where our schools are identified as high needs or low needs schools, and we work closely with our school boards on an annual basis to provide assessments that determine schools that would be classified as high needs. All high needs schools are provided with a dedicated school nurse that really gets involved in the school health assessments as well as the needs of the population and working with the administration to make sure that there are customized supports that are provided to to very specifically support the health needs of that school. We provide age-appropriate mental health and well-being supports. Certainly things, as an example, topically like sleep are something we might talk about with our younger age groups, up to certainly suicide prevention and resilience strategies. And again, we have very strong collaboration with our board. The health unit hosts a school board liaison group, which consists of our 4 major school boards on a bi-weekly basis to really talk about some of the issues and concerns that they're really hoping to focus on in the schools. We work with partners around really focusing on preventing sexual violence occurrences and providing students with support, with a real focus this year in 2023 on the concept of consent and what that means in particular on that secondary school age. Education and support, working closely with the chronic disease and injury prevention team around reducing substance use in schools, including tobacco, vaping, and e-cigarettes that my colleague just spoke about, and training and support related to healthy eating in schools, certainly with a focus on food literacy, recognizing in particular access to food, access to healthy food continues to be a focus in particular and a need for all of our high-risk schools here in Windsor-Essex. Turn it back over to Eric.
All right, I'm gonna bring us home for the sake of this presentation here. Within the school health standard is our Healthy Smiles Ontario program. Now, this program, as I mentioned at the onset of the presentation, is one that's operationalized by a department that doesn't align perfectly with the standard. So this is operationalized by our oral health department. And this involves the operation of a dental clinic in the city and county that serves eligible children under the age of 17 and under. Oral health screening takes place in all local elementary schools, and based on their level of risk, could involve grades JK, SK 2, 4, and 7 for higher risk schools, and then less grades based on risk, but we are in every elementary school in the city and county. These health screenings take place with a registered dental hygienist and dental assistant employed by the WICHU and are deployed throughout the school year. There is parental notification and enrollment into the Healthy Smiles Ontario program for free treatment based on the results of these screenings that take place in schools, as well as the provision of oral health services to qualifying students as a result of that. We also offer education and support as well as health promotion in schools. Outside of the standards, 100% funded program called the Ontario Seniors Dental Care Program. Again, a lot of people don't associate the health unit with having an operating dental clinic on site. We do, and we provide access to free dental care for those 65 years and older, and this takes place again in the city and county. Or we would refer, based on availability of clinic space, we will also refer to community dental offices as well. And we offer a wide range. We have dentists employed at the health unit, and we offer a wide range of different treatments, from checkups to repairing teeth, to offering x-rays, removing teeth, treatment of infection or pain, and some of emergency services on site, in treating gum conditions and diseases, as well as the provision of dentures by an on-site denturist. And that brings us to the end of the presentation. Again, this is a high-level sort of snapshot of some of the programs offered tied to those 9 overarching standards. Thank you.
That was excellent. That was really excellent, and I mean, as a returning member, it's wonderful to see that and all the work that we do as a health unit. But surely for new members, you can get a good taste, and that was a really good primer on the good work that's done by staff here at the health unit. You know, before I turn to any questions, I just want to comment. At the outset, Christy and Eric talked about this being an evidence-based approach, and I can just testify over the last 4 years, I can corroborate that, that it's the work is rooted in evidence-based practices, and the process that's undertaken on a lot of initiatives, in my view, is like the gold standard. I sit on a lot of boards and committees, but the work that the health unit undertakes and the conclusions that they draw on a lot of initiatives are often met with an excellent process that engages a lot of members in our community. And although the standards and protocols sometimes transcend across health units or overlap with other health units in a lot of these initiatives, there's a real local touch in a lot of the work that we do, again, rooted in evidence, but that really meet the needs of the Windsor-Essex community. And you saw a lot of that in this presentation today. And that's the real power of the Windsor-Essex County Health Unit. And so it's so important that we always keep in mind and emphasize that local evidence-based initiatives is what makes this organization so unique. So I'll turn it over to the board. Any questions or comments? Mr. Bichetti.
Thank you, Fabio. I just want to thank Eric and Christy for the report. You guys knowing being in the schools and just recently retired and experiencing the past 2 years with the COVID, the health unit was our savior in managing those schools and the outbreaks. We were, at the front line taking the phone calls, whatnot, but the health unit was right there beside us throughout the pandemic, and we would not be able to survive and keep those schools open if it wasn't your guidance, your support, and staff that came out there. It seemed like it was every other weekend and calls that were coming. So I just want to note that in that regard. Also, just a question, I think it was slide deck 7, Christy, you talked about immunization. I know in the past this board did send a notice, I don't know if Doctor, you can weigh in on it, that once the pandemic becomes an endemic, that we would lobby the province, the medical officer of health, the provincial doctor, to look at making it the ISPA mandatory. Is that kind of gone down the wayside, like in terms of other health units? Because I know at the time, all the health units were pushing for that. Is that kind of off the radar, or is that something that's still there? Has there been any updates in that regard with immunization with the COVID vaccine? So I'm not sure who to direct that question to.
Board Chair, I'm happy to comment if you would, or if Christy wants to comment first, I can supplement it. So from my perspective, and if I could just share, Ontario has always been at the forefront of public health services. And in fact, the first public health unit was in Norfolk County in the 1800s. The Immunization for School Pupils Act is a very progressive piece of legislation, and the success of that was borne out just this past fall, where approximately 19,000 high school students came up to date on their vaccines. So the Public Health Service can take credit in small way for that, which is that the young people are going to leave high school up to date on their vaccines, and not a small number, but virtually almost all the students. I think of the 19,000 students, 18,500 or so were up to date. It was a very good number. I think as it relates to the Immunization for School Pupils Act, there are certain vaccines that are covered and certain vaccines that are not covered. Like polio is covered, diphtheria is covered. Thankfully, we're not dealing with polio cases in my career, with new polio cases. So I think it's been successful. From my perspective, and I don't want to speak for other medical officers of health, but many have gone on the record on this, that I think that COVID vaccination should also be included in the suite of vaccines under the Immunization for School Pupils Act. I think that, and not to be long-winded, Board Chair, when one gets vaccinated, they're not only helping themselves, but they're helping someone else in the community. And I think that the Immunization for School Pupils Act is one piece of our communitarian belief in helping other people. And so I'm hopeful as time goes on that we'll consider what vaccines should be included in the Immunization for School Pupils Act. And as we move towards normalization of COVID, as we move towards that more endemic phase, I think it'd be a wise thing for us to do. Sorry for that long-winded response, members of the Board of Health.
No, thank you, Doctor. I appreciate it. And again, thank you again to the team.
Thanks, Joe, and thank you, Dr. Nazatari. Any other questions, comments? Dr. Ken Blanchette.
Thank you, Mr. Chair. Just 2 quick comments. One, to acknowledge the staff and the leadership of Eric and Christy on these elements. Again, I'm going to reiterate, this is just a highlight of the things that we are doing at the health unit. And I want to share with the board one of the visions that we have. The pandemic has created a heightened level of awareness of the health unit across Windsor-Essex. We want to leverage that awareness so that we can advocate for all of these elements that were on these 21 slides that you saw today, because there's a vast majority of our population that do not realize that these are the things that we do and that we can help them, whether it's disenfranchised within all of your communities, within the city itself, the county itself. And I think it's our job to run with that awareness so that we can create a better standard of public health within Windsor-Essex. Thank you, Mr. Chair.
Thanks, Ken, and I agree. I think one of the silver linings with the COVID experience is that it's heightened the health unit's brand in the community. So a lot of people certainly are more aware of the health unit today than they ever were in the past. Any other questions or comments? Okay, seeing none, this is a great segue, in fact, into our 2023.
Actually, sorry, Mr. Chair, I think Ronaldo had a question.
Oh,
very sorry.
Yep, Councillor Agostino, sorry about that.
You know, been hearing the term endemic for a few times today. Do we have any idea how far we are from that, from the point where we're moving into the next stage of COVID, really?
I don't think there's a clear epidemiological scientific answer, but I can give my own personal perspective. I think the answer is today and moving forward. Now, actually, we've said it before in writing in the Windsor Star. We have to move towards normalization, and normalization doesn't mean that COVID's going away. What normalization means is we learn to live with it, and learning to live with it means, like we learn to live with HIV or other infectious diseases, is putting forth a suite of programs and services so that we can continue on with our lives as a community, but also minimize the burden of disease. And so I think that process should happen now. And we actually at the Public Health Service, I think my colleagues and I feel that 2023 should be a year when we continue to manage COVID, but we also shift to other priorities. And from my own personal view, I think one of them is to deal with the number of deaths that we're dealing with opioids. I think the last estimate I had was about 80 people died last year in Windsor-Essex, 2,500 people in the province. And I think we have to shift towards that view of endemicity, recognizing that in itself one could dispute when one makes that judgment. But I would prefer to characterize it as normalization, if that's a fair characterization. I hope that answers the question.
It does, thank you. The reason I ask is because, you know, last time I got my last COVID shot, I actually got it in the Windsor-Essex County Health Unit trailer. And I got the shot at the exact same time that I got my flu shot. And I thought to myself, you know, are we getting to a point where a COVID vaccine is just integrated into the flu shot, just, you know, for the normalization aspect of it all? It's just the future, the way things are going to go. So that's why I brought it up. I was curious. Thank you very much.
Yeah, and if I could just supplement that too as well, it's a very, very good point. Just like HIV, we have medicines to treat HIV. We have medicines to treat certain groups of people who have COVID. We have vaccines, which I think if we can get to the point where we can get our vaccination rates higher, that will lead to a better level of normalization. We have to evaluate the burden of disease at any given point and adjust our public health measures based on the burden of disease. And we have to have sufficient hospital resources to care for people who might get sick from COVID. One message that's not well understood is many of the people who are dying of COVID are perhaps later in life, but many of them are living in the community. They're living independently. I don't think my mother would be unhappy with me saying my mother is 81. She lives independently in the community. She's got many more years of life to live, and the last thing I want is her to get COVID and succumb to it. So I think that as we move forward with normalization, those are the rational public health decisions we have to make as a community.
Thanks, Councillor, and thanks, Dr. Nazatari. Any other questions? Comments? Okay, seeing none. Again, as I was mentioning, this is a fantastic segue into the 2023 budget presentation, and I'm going to turn it over to Mrs. Lori Gregg and Dr. Blanchette to go over the 2023 budget.
Thank you, Board Chair. I'm just going to share my screen, so if you bear with me for a moment. So good afternoon, everyone. My name is Lori Gregg, and I'm the Director of Corporate Services for the Windsor-Essex County Health Unit. Today, I'm going to walk you through the 2023 budget that is found on your page 32 of your package. On an annual basis, and to support our responsibilities as outlined in the Health Protection and Promotion Act and the Ontario Public Health Standards, we administration establish an operating budget to support the programs that my colleagues just discussed with you in service of Windsor and Essex County. The budgets that I'll present to you form the basis of an annual service plan submission to the Ministry of Health, a very detailed document that you will see once the submission is made. To understand the budget and our budgeting process, I think I need to provide some background, especially for our new members, about how it is the health unit is funded. So the health unit has effectively 5 different streams of funding, if you will. Up at the top, the Ministry of Health funds us on a cost-shared basis at 70%. In addition, the Ministry of Health funds certain programs at a rate of 100%. We have our obligated municipalities that fund our mandatory programs at 70%. We have the Ministry of Children, Community and Social Services that funds certain programs at a rate of 100%. And we have other smaller funding allotments. So I'll first talk about our mandatory program funding. So the mandatory program is, in effect, a lot of the services for which my colleagues have just presented to you. It is funded by grants from the Ministry of Health at a maximum of 70% of our mandatory program expenditures, and contributions from our obligated municipalities at a minimum of 30% of our mandatory program expenditures. So just to give you a little bit more of an understanding of that min-max that I referred to, I've got a little bit of a scenario for you. So I'll go slow. I apologize. I do like numbers. You will see lots of numbers all over everything I present. So in this particular slide, I have a year 1 scenario. And the year 1 scenario has just a basic mandatory budget of $100. The proportion of funding that, based on the current funding model, we would expect to receive from the Ministry of Health for this program would be 70. And the funding or contributions from the obligated municipalities would be $30. So in this particular example, the cost shared model is in balance and aligns with the global funding model as put up by the ministry. So for year 2, there are 3 different scenarios, and I'll walk through each of the 3. So in year 2, the public health unit has an increase in its operating budget from what was $100 to $110. So under the assumption that both the Ministry of Health and the obligated municipalities abide by the funding model, one would expect the funding from the Ministry of Health to be $77 and the contributions from the obligated municipalities to be $33. And in this scenario, everything is in balance. There is a second scenario that could arise in this year 2. And that second scenario would be that the ministry does not augment the base funding from year 1. So it maintains its $70, which would result in a shortfall in funding that would have to be made up by the obligated municipalities. So the funding cost shared arrangement is not imbalanced here, and the burden of public health programs and services fall greater on the obligated municipalities as compared to the Ministry of Health. In the last scenario that I have here, we have, and a scenario like this arose once in, I believe it was 2018, whereby the Ministry of Health provided dollars in excess of its 70% proportion of the budget put forward by the public health unit. So in this scenario, again, $80. When that occurs, the obligated municipalities, to remain in balance with the cost shared funding relationship of 70-30, would be required to increase their obligated contributions to 34-30 to keep that, again, keep 70-30 in place. If the municipalities were not to increase their contributions, that's actually a lost opportunity for the public health unit, because those are grant dollars that would have to be returned by the Ministry of Health to the Ministry of Health. So again, it's not a very straightforward relationship, I will say, but one that I thought, and I'm hoping that this articulates how the relationship actually exists. So with regards to the Ministry of Health, there are also programs the Ministry of Health does fund at 100%. So there's no burden of this program on the municipalities. And that would include our Ontario Seniors Dental Care Program, which I believe my colleague Eric Nadlin talked briefly about. We have something called the Associate Medical Officer of Health and Medical Officer of Health Compensation Initiative. Now, this initiative provides support to boards of health in recognition of certain stipends paid to a medical officer of health or an associate medical officer of health that is employed by the health unit. Typically, these stipends might be in recognition of a particular designation or certification that the physician has, or in support of an after-hours stipend. And then the last point here is one-time business cases. Examples of this have been in the past COVID, the public health inspection student practicum, our school-focused nurses funding, vaccine fridge replacement, and small capital funding projects. So as it relates to this last bullet point, and I will keep COVID, I would say that my comments don't relate to COVID, but any of these other one-time business cases that we may have that may fall into our annual service plan submission that is due in March of 2023, we will be bringing those to the board for their review and approval at the February meeting. It does not have a burden on the obligated municipalities, hence the reason why we've taken in some additional time to craft those business cases. We also receive funding from the Ministry of Children, Community, and Social Services. We have a fully funded program for our Healthy Babies, Healthy Children's program that also includes prenatal and postnatal nurse practitioner program services. For the purposes of this report today, we will not be talking about this program as this program has a funding year end that is April through to March. So in March of 2023, we will be bringing that budget to yourselves for your review and your approval. And then our last pot, which fluctuates on an annual basis, is the other. There are occasions where we receive grants, for example, our infection prevention and control hub funding and funding that we've received from our high priorities community funding. We also have offset revenue that comes from, it could be parking revenue recoveries, it could be user fees, vaccine reimbursements, and inspections. So this can fluctuate on an annual basis. And it does go to defray the costs of the mandatory program budget to both the ministry and the municipalities. So we'll get into the 2023 budget document. So the mandatory program budget, the total mandatory program budget net of any offset revenue for the 2023 year is $23,428,882. $495,626 increase over the 2022 budget. Primary rationale for the increases really is that, from a salaries and benefits perspective, we have had an increase of $601,100. We had a net increase of 2.04 FTEs to the program. So we have additional FTEs assigned to the program, more so as compared to the 2022 year. We also have certain increases included in there associated with their contractual obligations. At the end of this presentation, but before the resolution, we will be going in camera and we can speak more about some of those salaries and benefit pieces. From an other operating costs perspective, our other operating costs for the 2023 year have increased $240,669. There are a number of items that we list within the context of the report that go through any increases that we have year over year. There are a couple of which I'd like to highlight. In our program supplies line, we have a $466,000 increase over the prior year. Included in that program supplies line for the current year are $390,246 of expenditures to support the urgent care public needs site at 101 Wyandotte for the period January 1, 2023 to July 31st, 2023. Additionally, you will see that there were increases in our information technology expenditures for the current year. Our information technology group will be implementing Office 365 organization-wide, which will help us achieve two-factor authentication that we need to have in support of our cybersecurity insurance. There are additional costs that are going to be incurred to support an upgrade of a document management system that we have organization-wide for $20,484. And we will need to acquire and replace our current Windsor office storage appliance for $40,000. Other net increases in the budget also include additional costs to be incurred on account of We Choose Corporate Public Awareness Program, which Dr. Blanchette briefly mentioned, of $33,000. And a net increase in epidemiology and evaluation expenditures of $17,000 to support the acquisition of local data for public health programming and development and implementation. From a purchase services perspective, on the corporate side, they've decreased $195,000. Really, the 2022 year contemplates a translation costs of $32,271. And roughly 25% of our project management costs for a Windsor office project, which is $70,840. Why I say 25% is there are a couple things that we as a health unit intend to do relating to the office, our project, our Windsor office redevelopment project costs. So firstly, we intend to submit a one-time business case to the Ministry of Health to support that capital cost. Those business cases typically go from April to March of the fiscal year, so any costs incurred prior to that April date would not be eligible for reimbursement. So to support us from a cash flow perspective, there is an additional request from the municipalities to fund us in the interim until we receive that approval of $185,000, which is detailed later on in the report. And a couple of other items I'd like to highlight. Our insurance costs have increased $22,000 over last year. On an annual basis, we undertake a very rigorous review of our insurance requirements with our broker and ensure that there's appropriate coverage for all the programs and services that the health unit administers. And that includes any professional liability insurance, our cyber coverage, our directors and officers coverage, and general property insurance and commercial insurance. Parking has increased $22,500 over last year. And primarily what's happened here is we are looking to augment our parking for a proportion of the year to support clients coming to our Windsor office with regards to our immunization of school pupils program. The January through March timeframe will be a heightened timeframe for us having clients on site. So we think it's important for them to be appropriately supported with parking that is in close proximity to our health unit. And lastly, I'll comment on security. Security has increased over last year as well. It is up $23,398 over last year's budget. And again, in support of the Immunization of School Pupils Act, we have additional security on site to support our staff in the administration of that program. Last thing I'll comment on is offset revenue. Offset revenue has increased substantially over 2022, and there are three items I'd like to highlight in that regard. So firstly, we have an increase in vaccine reimbursements of $35,314 over last year. Again, that would be consistent with the augmented activities in the Healthy Schools program over immunization of school-age children. Secondly, we have an increase in offset revenue related to building. And what we've effectively done is we have carved out a overhead charge for our Ontario Seniors Dental Program based upon the FTE complement assigned to that program. The Ontario Seniors Dental Program does draw upon the resources of the health unit, and as it's 100% funded, we think it's appropriate to cross-charge them an amount for the utilization of our rent, utilities, telephone, and such. And lastly, there's an increase in other grants of $164,243. Other grants for the current year represents funding received from the high priorities community to partially fund costs associated with the operations of the urgent care public health needs site for the period January 1, 2023 to March 31, 2023. So from a funding perspective, in developing the funding assumptions for the current year, there are a couple of things to bear in mind. So firstly, we assumed a 1% increase in funding from the Ministry of Health. That 1% increase would bring the total base funding to $16,302,915. Secondly, we've assumed a 2% increase in funding from the obligated municipalities, bringing total contributions to $7,125,967. So, as indicated in the report, there is an acknowledgement that these two assumptions here does throw out of balance that cost shared arrangement that we have between the two, where the burden of public health is slightly higher on the obligated municipalities than on the Ministry of Health. But that was done out of an abundance of caution, because if we were to assume a 2% increase on both sides, the municipalities would be subject to paying additional dollars if it is that the Ministry of Health did not meet that 2% base funding increase. For the obligated municipalities, and on the screen right now, you will see we have, again, $7,125,906 of contributions. For 2023, those contributions are distributed based upon the census data information that we have available, published for 2021. The 2022 figures I will highlight were based upon the 2016 figures, as 2021 figures were not available at the time of the budget. So year over year, obligated municipality contributions would have increased $139,722. The next program we'll talk about is the Ontario Seniors Dental Program. The Ontario Seniors Dental Program is fully funded by the Ministry of Health. Total budgeted expenditures for 2023 are $3,072,752, a $691,374 increase over 2022. This increase is primarily attributed to the following. So we have an increase in salaries and benefits of $460,037 over 2022. The 2023 budget includes an addition of 4.75 FTEs to address increased program uptake and backlog of services. Additionally, there's an increase in other operating expenditures of $231,337 over 2022. As I just mentioned, in offset revenue for mandatory programs, this budget here will have an augment in occupancy costs over 2022 of $129,624. In addition, there are augmented costs on this program associated with information technology supports. And this is namely licensing that we're having to buy for FTEs that support this program, as well as hardware lifecycle renewal and additional costs for replacement of software used to document client services for this program. And again, it is presumed that this program will be 100% funded by the Ministry of Health and Long-Term Care. The next program we'll talk about is the COVID-19 program. So this program supports activities to prevent, monitor, detect, and contain COVID-19, as well as the administration and distribution of COVID-19 vaccines in Windsor and Essex County. As these expenditures are in excess of our mandatory program budget, they should be fully funded by the Ministry of Health. For 2023, the total budgeted expenditures are $5,592,071, a $3,660,313 decrease over the prior year. This decrease is primarily attributed to, firstly, staff are being reassigned to mandatory programs or leaving the organization, as certain of these staffs were temporary staff. So we have a decrease in FTEs that are assigned to support this program. of $3,060,313. There's also been an increase in program supplies, namely medical and personal supplies on the operating side of $274,000. And the rationale behind that is that, at the onset of the pandemic and in March of 2021, the ministry was supporting us with vaccine administration supplies and some personal protective equipment. They are no longer going to be supporting us for that, so we need to carve out budget dollars for that. And then lastly, we have a decrease in program supplies other of $44,685. Again, the 2022 budget contemplated that we would have to get some additional equipment or replace some equipment that had been provisioned to support COVID. That didn't, we don't expect that to come to fruition in 2023 as we see a change in the services and the activities of this program. So really the 2023 budget solely contemplates the requirements to support like licensing requirements to support the FTEs in this program, as well as some subscription costs for the vaccine booking system that we currently have. Another notable decrease in this program is associated with purchase services of $314,694. So in 2023, we anticipate spending fewer dollars to support things like additional facilities rentals, a call center, and other third-party support with various activities in our organization. And then lastly, we anticipate a decrease in purchase services associated with transportation of $117,075. So in 2022, our budget actually contemplated that we would be delivering COVID vaccines not only to physicians, but also to pharmacies. We really, we're trying to be cautious because we didn't know if perhaps the ministry would change direction in that regard. For 2023, it's been confirmed that healthcare providers will be the ones that we distribute to the COVID vaccines to, and that the pharmacies will be given COVID vaccines using the existing flu channels that through the Ministry of Health. Risk assessment. So with any budget, unfortunately, there's risk associated with it. A budget is our as administration's best estimation is how we see the fiscal year unfolding. So we've identified a number of risks associated with this budget. So firstly, mandatory program approval from the Ministry of Health. So again, the approval contemplates a 1% increase from what was $16,141,500 to a revised approval of $16,302,915 in 2023. If funding levels do not change from the Ministry of Health to align with those assumptions, then there is a shortfall of $161,415 that would be required to be funded by the municipalities as our board has approved the entirety of this budget. Absent those dollars, we would have to look to curtail services to our community, which could be very problematic. This budget also contemplates really no changes to the Ontario Public Health Standards or any other legislation. So if changes arise and there's no resulting increase in funding as a result, that could have negative implications for our budget. One-time funding approvals. As I said, with COVID, so COVID has been, initially when COVID came, we weren't sure how it was going to be funded. The ministry has taken the approach that so long as your mandatory program budget is fully expended, that any dollars in excess of that budget would be funded at a rate of 100%. What the ministry tends to do is they tend to review the expenditures on a quarterly basis. And if they see that you are going to overspend even your COVID budget, they will look to advance you additional dollars. Because again, they've committed to funding COVID. It's just how they fund it throughout the course of the year will be dependent upon the forecast that we put forward in our quarterly reporting. Current status of collective bargaining agreements. We currently have one expired collective bargaining agreement with our employees represented by the QP union. And should the results of those negotiations vary from what was included in the budget, that could have a financial implication for the obligated municipalities. inflation. Much like all of our municipalities in our local area, we too have inflationary impacts that we are subject to. We've done our best to try to integrate certain of those impacts throughout the course of the budgeting process. And we will continue to try to mitigate those risks, ensuring that we have appropriate procurements that occur in accordance with the policies and procedures that we have. And as well, we will actively monitor our budgets as compared to our budgets and our actual activity to ensure that we are putting in place appropriate mitigation activities should we see that we might be in a position of overspending. The Windsor office redevelopment project, again, this budget contemplates a very limited amount of costs associated with that initiative, roughly $70,000. An additional $185,000 simply to support the project managers that we have appended to the project will be required to support these activities for the remainder of the year. And it is our hope that as an administration, we will put forward a one-time business case from the Ministry of Health to get small capital dollars that would cover those costs and any additional costs that we may have for the remainder of 2023. So with that, and before we get to the motion, if there are any questions, again, not relating to a salaries and benefits piece, I think we could go through those and discuss those. So through the chair.
Okay, thanks so much, Lori. That was really well done, very thorough and detailed. If you don't mind, just popping back the screen so I could see everybody.
Certainly.
Does any member from the board have any questions on any and all items, save and except the labor piece? I know you guys have all read through the agenda package, and it was really self-explanatory there, but Lori did a great job. Any questions, comments? Okay, I'm going to need a motion to go in camera to discuss the labor piece. If I can get that direction. Deputy Warden Bichetti, seconded by Councillor Marignani. All in favor, opposed, and that carries. So we'll go in camera.
We're streaming in, Mr. Chair.
Thanks, Leanne. Okay, so we're back in public session. We've heard a robust presentation on the board, both in public session and in camera. At this time, I'm going to just ask if anyone has any last-minute questions or concerns before I call the motion. Okay, I'll need direction on approval of the budget. Moved.
Yeah,
By.
I'll move the budget.
Thank you, Deputy Warden Bichetti. And I need a seconder. Deputy Mayor Shepley, all in favor? Any opposed? Seeing none, that carries unanimously. Thank you. And that takes us back to another in camera. So I'm cognizant of the time. I know we've got about 18 minutes before IRCA starts. So I need a motion to go back into camera, everyone, to discuss in-camera matters. Councillor Agostino, Deputy Mayor Shepley, all in favor, opposed? That carries. We'll go into in camera now, please.